Rescue breathing and CPR, or cardiopulmonary resuscitation. Step 1. Check for consciousness. Grasp the victim by the shoulders and shout, "Are you okay?" If he or she does not respond, roll him onto his or her back after making sure that he or she has no spinal injury. If he or she has spinal injury, gently roll his or her head, neck, and shoulders together as a unit until he or she is on his or her back. If the victim does not respond, call for help. For children aged 8 and under, give 1 full minute of rescue breathing and CPR if there is no pulse. Step 2. Open the airway. Check for breathing. See if the victim's chest and abdomen are moving. Listen and feel for air moving out of the mouth. If the victim is not breathing, open the airway. Number 1. Turn the head to the one side and clear any foreign material from the mouth with your fingers. Number 2. Place one hand on the victim's forehead and tilt the head back gently. Number 3. Place the fingers of your hand under the chin and lift to pull it forward. Number 4. Sometimes just opening the airway will allow the victim to breathe. Keep the airway open and look, listen, and feel for signs of breathing. If the victim still does not breathe, begin rescue breathing immediately. Step 3. Begin rescue breathing. Number 1. Pinch the victim's nostrils shut with your thumb and forefinger. With your other hand, continue tilting the chin forward to keep the airway open. Number 2. Take a deep breath and place your mouth over the victims, making a tight seal. For an infant, place your mouth over the mouth and nose. Number 3. Blow air slowly until the victim's chest rises. Take 1.5 to 2 seconds to give each breath. Remove your mouth from the victims and take a deep breath between rescue breaths. Allow the victim's chest to fall and feel the air escape. Number 4. Give 2 full breaths, then check for circulation. Step 4. Check for circulation. Number 1. Locate the carotid artery in the neck. Number 2. Find the voice box or Adam's apple. Slide the tips of your index and middle finger into the groove beside it. Number 3. Feel for a pulse for 5 to 10 seconds. A. If there is no pulse, begin chest compression. B. If there is a pulse, continue rescue breathing only until help arrives or the victim starts to breathe on his or her own. If he or she begins breathing again, he or she still needs to be seen by a health professional. Number 4. Give rescue breaths. A. Adult, age 9 and older, 1 breath every 5 seconds. B. Children, age 1 to 8, 1 breath every 4 seconds. C. Infant, under 1 year, 1 breath every 3 seconds. Step 5. Begin chest compression. 1. For adults, kneel next to the victim. Use your fingers to locate the end of the breastbone or sternum, where the ribs come together. Place 2 fingers at the tip of the breastbone. Place the heel of one hand directly above your finger. Number 2. Place your other hand on top of the one that is in position. Do not allow your fingers to touch the chest as they may damage the ribs. 3. Straighten your arms, lock your elbows, and center your shoulders directly over your hand. Number 4. Press down in a steady rhythm using your body weight and keeping your arms locked. The force from each thrust should go straight down into the sternum, compressing it 1.5 to 2 inches. It may help to count 1 and 2 and 3 and 4, up to 15 compressions. Give 1 downward thrust each time you say a number. Lift your weight, but not your hand. Open the victim's chest on the up stop. 5. After 15 compressions, quickly do the head tilt or chin lift and give 2 full, slow breaths, taking 1 breath in between. Number 6. Repeat the 15 compressions, 2 breath cycle, 4 times. Check if the pulse again. If there is no pulse, continue rescue breathing and chest compression until help arrives, or the victim's pulse and breathing return. Number 7. For a child, use the heel of one hand. Press with less force, compressing to the sternum 1 to 1/2 inches. Number 8. For an infant, place 2 fingers on the sternum, about 1 finger width below an imaginary line connecting the nipples. Press with gentle force, compressing the sternum about 1/2 inch. 9. For adults, give 5 chest compressions, then breathe. Repeat 4 times and check the pulse again. If there is still no pulse, continue rescue breathing and chest compression until help arrives or until the victim's pulse and breathing are restored.
Practice session.
Sir! Sir, are you okay?
Unconscious.
Unconscious. Help!
Position of the victim. Open the airway. Used head lift method. Check for breathlessness. Give 2 full breaths. Check your pulse.
No breathing, but there is pulse.
No breathing, but there is pulse.
Call the AM systems for help.
No breathing, has pulse. Please call 911.
Now begin rescue breathing. Recheck pulse.
Has pulse.
Has pulse.
No breathing.
No breathing.
Continue rescue breathing.
Victim is breathing but still unconscious.
Step-by-step procedures of CPR.
Sir! Sir, are you okay?
One and two and three and four. One and two and three and four. One and two and three and four. One and two and three and four.